It's that time here on Smooth 98.1, where we get to talk about your health on Smooth 98.1. Yes, Smooth Health. I'm always excited when it comes to Smooth Health. You can always tell from my voice. Oh my days. Well, who doesn't want to live longer? We all want to, don't we? Well, today on Smooth Health, we'll be talking about misconceptions, where, well, we'll talk about the myths, break those myths, and then share the facts where fibroids are concerned. And talking about fibroid, I've got a guest with me in the studio in the person of Dr. Afolabi John Oluwaseyi. He is a consultant obstetrician and gynecologist at Renton Multi-Specialist Hospital. And with that, I say good evening. Good to have you with me.
Good evening. Good evening.
Awesome.
Thanks for having me.
My absolute pleasure.
Yeah.
Well, ladies, as you always know, the conversation isn't just myself and the guest. You also are part of the conversation. You have questions, someone who's going through had a fibroid before, what causes it, all that good stuff, questions you want to have answers to. Well, I guess will be fed more insight on that. And then you can also ask your questions and share your thoughts on that. I'm talking about sharing your thoughts. In case you're wondering how you can do that, WhatsApp is the platform to ask your question. 0911 999 091 0911 999 091. That is the WhatsApp number to share your questions, your thoughts, and all that. Well, where do I begin? I think we should first start off with what fibroids are. I think we need to understand what fibroids are. Maybe once we understand that, we'll be able to get away from and then attack what the myths are and what the actual facts are.
Okay, so just talking generally about fibroids. Fibroids are non-cancerous masses that affect the uterus.
Okay.
Saying it in such a way that people will understand it. We address it as benign tumors of smooth muscle origin.
Right.
Which means it's non-cancerous. So the cause is basically unknown. Basically unknown, but there's some things that has been put up that may be responsible for it, which you have some hormonal, hormonal references, yes, some somatic mutations. Those are all jargons, but let me not just disturb everybody with it, okay? So now there are some people that have the risk to, have this fibroids. We have in Nigeria, we are blacks, so blacks have high risk to have fibroids.
Oh, so we're more prone because of our skin color.
Yeah, because of our skin color. Now, if you starve your uterus of pregnancy, you are giving room for fibroids to grow in it. So especially if you're going beyond the age of 30. So, women above 30 not getting pregnant have the increased risk of having uterine fibroids. Okay. There are some factors, dietary factors, and some environmental factors, although not so proven, that could be associated with fibroids. Diets such as food, processed meat, red meat, high starchy food, saturated fats with, from animal source. All those are some that has been postulated, but not so 100% like that. Environmental factors like exposure to certain pesticides and also predisposed to having someone having fibroids, but majorly the cause is unknown.
Okay.
Yeah.
Oh my word. You just hear certain things and think, okay, that could be the reason why someone is experiencing that, but so far so good. There are no main causes per se.
Yeah, exactly.
One could just be predisposed to it because of our skin color,
family history.
Oh my goodness! Now, just just thinking about how it is. Especially, well, I don't want to say I know it, but for clarity, who usually have fibroids, so we can get out of the way.
Okay. Black women have fibroids, age greater than 30 years, Nulliparous meaning you don't have any, you've never gotten pregnant before. You're given access to that uterus to get exposed so on, estrogen, which is the hormonal part I was talking about.
Right.
Yes, which, makes those fibroids get bigger in there.
Ooh, we learn every day.
Definitely.
We learn
So,
every
but people make a lot of fuss about fibroids to make it look scary. Like, okay, if I have fibroid, it means it's a death sentence. It's just not. I've heard a lot of things in Lagos, people going through fibroid surgery and dying from it. I don't know how that happens. It's strange to me actually, because people don't die from fibroid surgeries. If you have fibroids, it does not kill. It is just a non-cancerous mass that is just there. In some cases, no, let's just move on to the symptoms.
Go, please, by all means. Let's focus
Yeah.
on that. Let's talk
So,
about that.
some people will just find out that they have fibroids by just going for a general scan,
Okay.
just for something else entirely. So when you go for the scan and they find fibroids, some people start getting worried unnecessarily that, oh my God, I have fibroids. What am I going to do about it? These fibroids are not doing anything to you. Just leave them alone.
But well, thankfully, you're the doctor, so there's the misconception that fibroids can prevent or restrict one's ability to get pregnant.
Okay.
So there's that fear once you have, or you've heard that you have, possibly you've got for your scan, you have your general checkup done, and the next thing, oh, okay, you have fibroids, you have clusters everywhere. And the next thing you're wondering, but I was told that these things can kill, or those are the myths that we hear. I'm talking about myths. I think we need to start with that. What are the random or most ingenious myths you've ever heard of? Besides the fact that you hear that fibroids kill, what other myths have you heard?
So let me go straight with the first one, which is fibroids can kill.
Okay.
It does not kill. The symptoms don't kill you at all. The symptoms can easily be managed.
Okay.
However, if in situations whereby you want to manage fibroid and you go to meet people that are not professionals, definitely they can kill you because they don't understand anything about it. They just see fibroids, everybody wants to take a fibroid out. No, you don't have to take it out, not all the time, except you have symptoms. Now, certain myths that you need to know is that if I have a fibroid, I can't get pregnant.
Right.
If you have a fibroid, the relationship between fibroid and infertility is a causal relationship, not a causal. It doesn't cause infertility. The relationship may just be romancing themselves, but it's not really doing anything.
When you say romancing themselves, that's so nice, but
so let me just explain that. Let me explain that. What it means is that, fibroids does not cause infertility. But when you have checked every other thing that could be responsible for infertility and you don't find any, that is when we now lie sometimes that maybe if it is the fibroid, maybe if I take out your fibroid, maybe you will get pregnant. And studies have shown that about 30 to 40% of patients, after taking out the fibroids, some will get pregnant. Okay. Yes, and some won't get pregnant at all, which means the fibroids don't actually cause infertility. There are so many ways that has been postulated by which fibroid can cause infertility, which means it can increase the distance the sperm will travel to get to the egg. It can increase the contractility of the endometrium, where baby stays. It can decrease blood supply to that region. It can cause atrophy to that region. So those are just minor ways in which the fibroid may cause infertility, but the relationship is causal.
It's not something as has been postulated by most people, or it's the actual cause, because that's when you see people wanting to remove all the quote unquote, yeah, you can only see me if you're watching via YouTube. You see them say, oh, we have to remove all the fibroids in your tummy.
Exactly.
So that you can be able to carry.
Exactly. So even if I remove all the fibroids, you may still not get pregnant.
So infertility is a different ball game on its
a
own.
different ball game on its own.
Fibroid is a different situation.
Completely different, yes.
So you need to figure out what's causing infertility and tackle that, and just bear in mind that yes, even so is it possible that someone could be pregnant and still have fibroids? Could that could that cause any complications? Yes.
Oh yes, that's a good question. So you have a lot of people with fibroids and pregnancy. They coexist together.
Right.
Now the problems is that in some cases the fibroids may cause a miscarriage. It may cause a miscarriage, yes, definitely. So in that kind of situation, we go after those fibroids because this is now becoming a problem.
Okay.
Yes. In the second trimester, some of those fibroids can undergo degeneration, in which it will start causing severe abdominal pains for the woman. Then when it gets to the third part of the pregnancy, it may cause some other complications, in which case the baby may be in an abnormal position. So you may have to do a C-section to deliver the baby. You know, it may cause bleeding, cause an abruption. The placenta can separate before the baby, you know. So it can do a lot of things in pregnancy, but at least more than 50% of women will still have a coexisting fibroid with pregnancy and have a safe delivery without any complications.
So what are I need to come back to the age range of those who are likely to have it, because if you say it is women who haven't had them, because I might be wrong, but I've heard that if you've never been pregnant before, you are likely susceptible to having fibroids, and even if you've been pregnant before, say you've taken a
break, yes,
from having a child, and then you now want to go back in, say 5 years, 10 years, there's a possibility you might have a fibroid.
No, it's just a possibility, not 100%. It's not a certainty. Now, women greater than 30 years are more likely to have fibroids, especially if you are not pregnant. You know, so when you're not pregnant, you give the uterus the opportunity to have unopposed exposure to the estrogen, which is notorious for causing these fibroids to start increasing in size. You know, the cause is unknown really, but there may be some familiar, genetic, somatic transformation reasons whereby some things will just go wrong and fibroids will start growing just because we are blacks.
Sometimes you wonder if it's a curse or if this is the only way out. But I'd love to know what your thoughts are regarding questions you have, possible contributions on Smooth Health this evening. We're discussing fibroids, tackling the myths, and also sharing the facts. My guest today is Dr. Afolabi John Oluwaseyi. He is a gynecologist, obstetrician, and he is with Reddington Multi-Specialist Hospital. We'll have a quick breather. On the other side, we will definitely be touching on, when it is important to see the doctor, how things can go awry if you also see the wrong doctors, where herbal concoctions come in. You see those ones? We'll touch on that on the other side. Don't move a muscle. Stay close to your radio. Smooth 98.1.
The Sims Black Friday sale is here.
We're doing great.
We're doing good. You can enjoy up to 70%
talking about
on
interesting take though. Interesting take. No, I'm not even talking about the question. Certain people don't realize that when they hear fibrosis, it's a death sentence, and really it shouldn't be.
Yeah, it shouldn't be.
It's just something that will happen.
For more details,
Caucasians don't have fibroids.
We have seen some, but Caucasians really. The last one I saw was a South.
That's from so many things.
No. They have their own too now. They have their own. I've seen some now coming from India with fibroids. Yeah, India, then South America. Yeah, they are fibroids too now. Why? They are not blacks, but we don't know why. So the cause is unknown still.
So could that be because we're interracially
Barry?
It's a possibility as well. But
Because
nobody,
we never used to have it before, now
we have it, but nobody has been able to prove that. No studies to prove that.
We're not ready.
Mm.
People would say, oh no, so this is why.
Yeah, you know. All right.
Lagos, you are still tuned in to Smooth Health here on Smooth 98.1. My name is Joy Oluwaseyi, and I'm joined by Dr. Afolabi John Oluwaseyi. Okay, and well, today we're talking about common myths and misconceptions. Well, talking about the myths, the facts, and debunking all those things you've always heard where fibroid is concerned. You have your questions, you have your contributions, things you've always heard, and you want to get your exact answers. Well, you can do that by sending your questions, contributions to us on WhatsApp 0911 999 0911 999 and yes, Dr. Falabi will definitely tackle that. Now let's get back to a conversation, and here is something that is of interest to me. So, as is with I'll just say with most ailments, there is this natural urge to look for alternative solution.
Yeah.
And I'm using that lightly. So you find where someone is going through malaria, is having some ailments. The next thing you're hearing, oh, there's a herbal concoction that can remove everything.
Yeah, you're right. You're right.
Especially in the sky.
Yeah.
Now let's touch on that, especially now where fibroids is concerned.
Okay.
We've seen, at least I've heard certain people claim to use. I haven't done the studies yet, but I'm sure that from your specialty, you've heard people come through, ask questions, oh, they've used herbal concoctions. Have these ever been effective, or is this a method that people shouldn't even try? I know you also shared the medical science behind that, but help us understand that. Is that even something one wants to try?
Okay, thank you for that question. So you don't, fibroids don't respond to any form of herbs.
Okay.
In fact, you're complicating the situation by using herbs. For example, there's a particular type of herbs that some women use. They give them tablets to insert into the vagina. And the mechanism they tell them that works is that it will help to shrink the fibroid, and they will start passing the fibroid through the vagina outside. So eventually, once they put that tablet into the vagina, that tablet causes a lot of burns in the vagina and causes the woman another problem entirely. The vagina could gum together, and that's it. Then you start looking for how to open the vagina again. So there's so many herbs, leaves, concoctions that they prepare for women to use. A lot of, in fact, some have started using holy water to start drinking it. All this don't have anything to do with fibroids. Now, the symptoms of these fibroids are usually very severe for some women, so you can't blame them sometimes when they look for alternative. Yes, symptoms like severe abdominal pains, heavy menstrual flow, pressure symptoms, constipation, leg swelling, you can name it. So a lot of people source for every other avenue, but all these things don't work. The best thing is still to consult with a professional who will be able to explain in details on what to do in the line of management. And most of the time, when people come to us, some of these patients, we don't do anything. We just tell them, madam, see, this is not disturbing you. Please go and rest. Just go and rest. If it becomes
what's the fear behind it?
Yeah, because now some people fear that I have this thing in me. Can it become cancer? It can never become a cancer.
Right.
Yes, it can never become a cancer. Some women have asked me about a particular variant. We call it a leiomyosarcoma.
Okay.
Now, when we are diagnosing fibroids, sometimes the leiomyosarcoma looks like fibroid too on ultrasound. But by the time we surgically remove it and test it, that is when we see it. But this particular leiomyosarcoma I'm talking about is very rare. It's like 0.1%. So it's very rare, you know. So you hardly see it. So if you have a fibroid and it's not disturbing you, just leave it alone.
Oh, we have a question here. Good evening to you too, David. David says, it seems that fibroid is racist. Yeah.
Oh, yeah. He said what?
His question is, does womb removal remove fibroids? Because he's read of research about how inflammation also is a trigger for fibroids. How do you use that?
No, that is not true. That second line is not true.
Okay.
However, the womb removal removes, that's hysterectomy. Yes, remove the fibroid. That is actually the definitive management for uterine fibroids, because if we remove fibroids only, the fibroids have the tendency to grow back within 3 years after removal. Yes, it can grow back. So the definitive.
So it's not remove it now and that's the end.
No.
There's a likely possibility you still have it again.
Yes, there's a likely possibility you may have it again, except you are approaching menopause. Once you approach menopause, then you are free from the fibroids. It's not likely going to grow after that. Once your period stops, the fibroids won't grow again.
So are there ways in which it could be shrunk?
Yes, definitely. Now, we have certain injections that we use that can use to shrink the fibroids if the patient doesn't want to go through surgery. Yes. Now, there are many management options, you know. People believe hysterectomy, like this questioner, hysterectomy is the only. No, hysterectomy is not. You don't have to go through all of that. We can just remove the fibroids and leave you alone. Okay. We may not even go through surgical methods.
Right.
Yeah. We now have, we can just give you drugs, symptomatic management. If your symptoms are not too bad, if it's pain, we give you painkillers. If you're bleeding, we give you something to stop the bleeding. If you have some pressure symptoms, we can manage it, medically without using anything surgical. Now, it is those that are not now responding to the medical that will now go through surgical. Now, surgical technology has advanced. You have some minimal access surgeries that we do. We just make a tiny hole, remove the fibroids, can remove it from the vagina, Now we even have the HIFU, in which you just use high intensity focused ultrasound to just look detect the artery supplying that fibroid, then, just embolize it, and that's it. Fibroid starts shrinking. So
when they say medicine is progressive, that's what we mean. It's not back then you'd hear, unless you remove the entire thing or you remove your womb, as they would say. So that's the only way to tackle situations.
No, it's not that hard. It's not that deep. People, those are one of the misconceptions that, I have fibroid, I have to take it out. No, you don't have to take your fibroids out.
At what point do you even realize, okay, well, I know you've highlighted that, but at what point does a woman start to, so is there any likely possibility that a woman who's hitting menopause could by any chance have could have a fibroid?
Yes, there's a chance, because there's no never in medicine. She still has other sources of, because she's getting to menopause. The estrogen level is getting low. For example, if she's obese now, she also has some estrogen supply from the skin. So she still has
there's a likely possibility.
There's a likely possibility.
Even if she's hitting menopause.
Yes.
And here's what sparked my question, because we've seen older women now, women in their 50s, who said they've experienced some part of menopause, but all of a sudden they're getting pregnant, so they're wondering how that could have happened. So hence my question regarding fibroids.
That's why we say there's no never in medicine. There's some There are some things you can't really explain why somebody after 50 something is still pregnant, getting pregnant at that age, but it happens, but very rare. You understand? But, we know that by the time you're approaching menopause,
Right.
you should, in fact, if you have fibroids and you're probably 48 and it's giving you symptoms, we may just advise you, madam, you're just about to enter menopause, just wait it out. Let's just do something medical for you till you get to menopause. Once you hit menopause, you don't have most of those symptoms anymore.
We learn every day.
Yeah.
And that has been okay. So, but you're giving us a bit of the treatments. What are the ways to manage it? What are the? I know that there are ways to just it's either you want to go through the hysterectomy if that's your thing. You have medications that can be used. You can do minimal surgery if that's a thing.
Yeah.
But if one has it right now and is conscious, what are the ways to manage it? Is it looking at their food intake? Is it minimizing something, increasing something? Are we also looking at medication that would need to increase as a woman, as a Black woman? Emphasis on Black woman, because I've rarely ever heard where Caucasians actually have fibroids.
Yeah, quite rare, quite rare. You won't find it in there. Although we are seeing some white women now having fibroids. Seeing saw some from South America, then found one in an Indian woman. So, so we're saying, but so that's why we say there are so many things that are changing.
Is getting to find out. So, yes, what are the management food? Should we be changing our diets?
So you just basically reduce the processed meats, and all those. These are just minimal ways. They're not like fully evidence-based that this, if you do this, it will prevent you from having fibroids. You can't really predict
what and how.
Yes, what and how, but the ones that people have studied, processed meat, high starchy food, saturated fats.
But we have a lot of stuff.
Yeah,
so that's a bit of a complex situation.
Alcohol, yes, all that you need to reduce it. Reducing those will also maybe reduce the way the fibroids will start growing in the woman. So
I have a question here. The the question is what if well, this is anonymous.
Yes.
I shall not names shall not be mentioned. However, the person wants to find out what if in a situation this said woman has never copulated but is already experiencing fibroids. Is that something she needs to worry about?
Okay, she's never copulated. She doesn't need to worry about it yet because she has not even tested anything, She doesn't know if she can tell. She doesn't know. She's not. So if she's not having symptoms, she should not be worried about it. She should just let it be until she gets married. Get married, attempt to get pregnant after a year or two. If you're not getting pregnant, then you see a professional to consult with, then find out why. If they don't find anything, then like I said earlier, we will now lie that it is the fibroid. Maybe if we remove it, maybe you will get pregnant. Yeah, So she shouldn't be worried. There's nothing to worry about with that.
Okay. Well, thank you so much for all that insight today. This has been very educative, and I'm sure Lagos has learned a thing or two. So for those who are possibly still shy, like Anonymous who sent in a question, how can they reach out to you on your social media handles to further take it up from there?
Okay. They can reach out to me at Reddington Hospital, Instagram. You can use the Instagram page. You can check Twitter. You can check me on Facebook. Yes. Reddington Preston Gynae Center. You can reach out to me there.
Okie dokie. Find it. Well, okay. Let me take this last message. It says my wife did a major surgery in 2016 for fibroid removal. After much tests and scanning that lasted for months. Before the surgery, she always fictionalized the herbal stuff.
That's
When they told her that the herbal medication will drop
Oh,
the
that's
fibroid,
not
which
good
I
enough.
knew was impossible. In fact, the surgeon lectured us thoroughly prior to the surgery, and thank God today she's fine.
That's a good news. That's a good.
That she's fine.
Yeah, exactly.
Please.
Completely, please stay away from it. It will mess up the whole thing. By the time, in fact, by the time some people use it and it gets worse, it's already very bad. You don't know what to do again. So please stay away from herbs completely. And please, if you have fibroids, it does not kill you. Don't ever believe that. Okay?
Oh, well, that has been Smooth Health here on Smooth 98.1. It comes your way every Thursday at 5:15, and every week we have something interesting relating to your health to tackle and enlighten you. But next week will be another opportunity, but in the meantime, I'm going to leave you in the hands of Jay Williams, because your style might not necessarily be my style, but it is important to take good care of your health.
And I help every Thursday at 5:15.